This is Julie Johnson, and today I'm going to be talking about systems of care, and specifically the clinical microsystem. This is part of our Patient Safety Certificate Program pre-conference webinar. I'd like to start by asking a simple question: what is a system? A system, as defined by Deming, is a network of interdependent components that work together to accomplish a shared aim. Deming liked to tell us that every system has an aim. If you don't have an aim, you don't have a system. Every system must be managed, and management requires knowledge of the interrelationships between all the components within the system and the people who work in it. And by that, he meant that to be able to manage a system, you have to know all the parts and all the people that work together in that system. In healthcare, an understanding of systems is very important because it's really critical to understanding patient outcomes, safety, and quality. We know that physicians acting alone are not sufficient to improve the outcomes of care. They're part of a greater system of healthcare providers. We also know that when we're preoccupied with the system elements, all the different parts of the system, we start to lose our sight of how the system operates as a whole, and the effects of the system on patients remains invisible. And finally, we know that every system is perfectly designed to get the results it gets. I'd like to say a little bit more about that quote. It seems very simple, yet it's quite elegant in helping us understand that the reason that we have the outcomes we experience today is because we've created the system that is producing those outcomes. Systems are at the heart of safe and effective patient care. In 1999, the Institute of Medicine released a landmark report, To Err is Human. This report highlighted the problems with patient safety. Medical errors are a serious problem. They also pointed out that the cause of these medical errors are the bad systems, and redesigning our systems will help us fix the problems. What they didn't point out is what systems we need to work on, and there are different levels of the system. There's the provider, patient level, the clinical microsystem level, and the macro organization and community level. My area of research is the clinical microsystem level, so I'm going to spend some time really going into that to help you better understand why I think this is the system level that we need to focus on for our patient safety and quality improvement efforts. You can think about systems like a series of nested circles. At the center of the diagram is the self-care system. That's the patient or the person who, for the most part, manages their illness without direct contact with the healthcare system. The next level is the individual caregiver in the patient system, and that's when the patient feels the need to reach out to a healthcare professional to help manage their illness. Those individual caregiver and patient systems exist within clinical microsystems. Those are the teams of caregivers who are working together to produce patient care. The next level is the macro-organization system. We have hundreds of clinical microsystems that exist within a larger macro-organization, like a hospital. And finally, our hospitals and macro-organizations work in a larger system, the community market and social policy system. And so you have to think about all that's going on at the community level that has implications for our hospitals. So it could be the accreditation system, the regulations, the different policies that have impact on our individual hospitals. I want to spend more time now talking about clinical microsystems. The clinical microsystem is the small group of clinicians and staff working together with a shared clinical purpose to provide care for a defined set of patients. It's really that clinical purpose that defines the essential parts of the microsystem. Once you know the purpose, you understand who the clinicians are, the support staff, you know the different types of information they're working with, the technology that they need, and you understand the care processes. Let's think about a cardiac surgical unit, for example. You know who the patients are, the type of care processes that are involved. You know who the clinicians are and the support staff that are needed to work with those clinicians, and you know the types of technology that they're using when they are doing surgical cases. So the essential elements of the clinical microsystem: the core team of health professionals, the defined population of patients that they care for, information technology, the support staff, equipment, and the environment, and those processes that are specific to accomplishing the aim. You can think of it as being the smallest building block. It's everything you need to provide care for that group of patients. We know that in the microsystem, the use of information is key to the microsystem's ability to function. And information technology can facilitate collecting, assessing, and sharing information. More technology isn't necessarily better. As you know, sometimes very low-tech microsystems are very effective in sharing information. Now think about the microsystem from the eyes of the patient. Often patients will interact with multiple microsystems as they navigate their way through the healthcare system. Think about a patient who's sick. They go to their emergency department. They're assessed and they're admitted. Once they're admitted to the floor, then maybe there's a decision to do a surgery. There's surgery and there's the post-op area, and then there's recovery on the ward, and then discharge back to the community. Those are multiple microsystems that are interacting. And those handoffs of patients and handoffs of information between the microsystems can be very difficult for patients to understand. And also, we know that they're very vulnerable times for patients. It's the same for our trainees who often rotate through multiple microsystems as part of their training. And they spend very short periods of time on those microsystems, so they show up and it's just expected that they will know how that microsystem operates. And often they have very little orientation to how the current microsystem works. And when they aren't sure how to navigate or change the system, they look for ways to work around the system to achieve their work in patient care. So where can you find a microsystem? Everywhere. Once you start to look at the world with the microsystem lens, you realize that all care is provided in a clinical microsystem. It could be a community-based general practice, a renal dialysis team, a cardiac surgery team. It goes on and on and on. The point is that all care is provided in a microsystem. However, some microsystems function better than others. So about 15 years ago, I did a study looking at the characteristics of high-performing microsystems. And what we found will not really surprise you. Microsystems that consistently perform well have excellent leadership. They have organizational support. They focus on their staff and how to further develop their staff. They also focus on education and training of the staff. They have a high degree of interdependence. That's how the people are working together. They also are focused on patients and patient care. They have a focus on the community and the market, and that means that not just thinking about the service that they provide to the community, but how the community actually provides the service to them. An example that I remember from the interviews that I did was one clinic that would invite patients with mental illness, who could come in and talk to their residents about what it was like living in the community with mental illness. And that really helped the healthcare professionals better understand the patients that they were caring for. High-performing microsystems also focus on performance results, process improvement, and how they integrate information and information technology. Now, I mentioned earlier that high tech doesn't necessarily mean better. What it means is that they are able to be very effective in how they share their information, even if they are low tech, and how the information is shared from healthcare professional to healthcare professional, but also how it's shared from healthcare professional to the patient. So why do I think that a focus on the clinical microsystem is so important? It's because the overwhelming amount of daily work is provided within a clinical microsystem, and our improvement efforts as well as our educational efforts will be more effective when they are designed and implemented at the microsystem level. And this changes the rules for the larger organization. The leadership of the organization needs to understand that their job is to support the work of the microsystem so that they can be more effective in the care they provide. So here's an example of a clinical microsystem. At the center of our microsystem is a patient. Now, this is a NICU, a neonatal intensive care unit, and the patients are small babies. Here is a nurse who's interacting with technology. Here is a neonatologist, the physician. More information technology, more healthcare providers as we keep adding team members. Here's the physician who is rounding with the patient's family. Patient rounds are completed at the bedside. And finally, this is how they all work together. It's all interrelated. Now, for those of you who are involved in clinical care, you understand that this is what care looks like at the front lines of the microsystem. But this is how we organize our hospitals. We create these diagrams that group all the physicians together, all the nurses together. We even group the information together and have a chief of information. And there are these reporting lines that keep the people in silos. So instead of working together, like this diagram of the clinical microsystem, Instead of recognizing how the microsystem functions, like this view of the neonatal intensive care unit, we treat our organization like this. And this may have perverse effects on our organization. It actually starts to pull apart the microsystem. We create human resource policies and practices that recognize groups of people, not microsystems. And we also don't recognize the role of the microsystem in training physicians, for example. We don't recognize that everyone in the microsystem has a very important role in training physicians or in training nurses. So how do we recognize that it's just not a physician training a physician or a nurse training a nurse, but it's the entire microsystem that's providing the training? I like this cartoon because it shows a garage, and in front of the garage are the two mechanics who are sitting there waiting for their next car to work on. And there's a car out front that's going around and around in circles, and they say, at what point does this become our problem? And I think that's the way we feel in healthcare a lot of times, is that we're looking at these problems and we think they're happening somewhere else. They're not our problems. They're somewhere else in the hospital. They're somewhere else in our country. They're in another country, the biggest problems that people are trying to work on. And when you start to think about care at the microsystem level, you realize that these are the problems that we all need to work on to improve. Unfortunately, sometimes it's easier to see the system when something bad happens. So when we're together in September, we're going to be talking about some adverse events, and we're going to be analyzing cases of medical harm to patients, and we'll be using a microsystem framework when we analyze those cases. I'm really looking forward to having that time with you in September.